Hi, we have with us today Pamela. And Pam, what we'd like to do today is tell the audience a little bit about, what brought you to our office and what kind of changes you've seen and what kind of experience you had, so that, perhaps someone suffering with a condition like yours would feel that they can be helped and would maybe think that our office would be a good place for them. You came to us roughly a month and a half ago.
Yes.
What was your diagnosis, Pam?
Pustular psoriasis.
Okay. So for those of you that don't know, that's a form of psoriasis that, particularly in Pam's case, affected her feet and her hands, and very dramatically. Is that correct?
Yes.
Really was affecting your life?
Pretty much.
Yeah.
For the last 8 years.
Okay. And what kind of doctors have you seen prior to us?
A specialist. I've done everything from Taclinex foot creams, foot detoxing, colonics. You name it, I've tried it.
Has anything helped at all?
No. I've done cortisone shots. I've done just about everything under the sun, and nothing has worked.
Yeah, I think that's the frustrating thing for a lot of our audience and a lot of our patients, is that they have tried a lot and they've gone to sometimes, Columbia Presbyterian or the Mayo Clinic,
yes,
and they're still not getting answers, and it's got to be awfully frustrating.
It is.
But the funny thing, and we've told you this too, there was a time in your life you didn't have these symptoms,
right,
which means your body can work without expressing them. And our goal from day one was to return you to a level of health where your body was working like it was prior to the onset of these symptoms, because we knew it could do that.
Yes.
But what we had to figure out was what was causing it.
Exactly.
Great. So what we did with Pam, guys, is she came to the office, and after a consultation, we ran some extensive blood work on her. And our blood work's a little bit different than your average blood work. We look for a lot of different things, and after reviewing the blood work, without getting into specifics, we really felt like we had the answer to Pam's problem, and we knew we could help her, and we told Pam that. And how'd you feel after we said we thought we could help you? Were you excited? Were you nervous? Were you skeptical?
Oh, I was a bit apprehensive. I've been down this journey. I've tried everything under the sun, and nothing is working. Nothing has worked. So it began to be a little debilitating. It was more of a hopeless situation. And I happened to be online, and I did see Dr. Ron and Dr. David's video. And that really hit home for me, because I'm very much into anything holistic. I know that food and nutrition has a big role in a condition like I have. And I said, you know what, they seem to know what they're talking about. Let me go have a little time with them and see what they have to say, see what all the fuss is about. I did see the website with all the testimonials, and I felt that perhaps they could help someone like me too.
And that's exactly the whole point of doing this. So when you came in, we told you that we wanted to do a 6-month program.
Yes.
It's our average adult program. Some people could do 3 months, but the average adult is 6 months. Doesn't mean you're going to be healed 100% in 6 months. It doesn't mean it's going to take 6 months either. We never know what to expect.
Right.
And the reason I'm asking you to share today is because you really had remarkable results in 3, maybe 4 weeks at this point.
Yes.
So just in your psoriasis alone, let's start with the hands. What percentage would you say is better? Is that 100% better?
Pretty much 100%, nothing there at all.
Nothing there. And it was really debilitating, guys. I mean, she really, had a really tough time with what was going on. What about the feet?
Feet have their moments, but I know I'm working through the cleansing right now.
Right. So
repair bites where I'm at right now.
Right. She's repairing the lining of her digestive system, which we felt was contributory to her problems.
But as far as how I feel, back to your question.
That's what I was going to ask you, is what about how you feel?
I feel amazing. I feel like I'm 19. I'm certainly not 19, but I feel 19. I've lost 10 pounds in just a short amount of weeks. And if I tell you, I'm one of those people, I juice every single day. I work out every single day. I am the most optimistic, motivated, meditational individual you're ever going to meet. And I've tried everything to lose even 5 pounds, and I've just lost 10 pounds already. I can't even believe it, to tell you the truth.
I think, one of the things we notice is that the more compliance we get from a patient, the better they do. Because the program works, and you were really compliant, and I applaud you for that. It makes our job easier.
Yes.
It makes the experience easier, and it's what it takes to get healthy, and you embraced it and did what you had to do. Now, as far as the food changes, I won't even call it a diet because we're not telling you to eat low calories. As far as the food changes, was that hard? Was it easy?
For me, simple. You know, I feel better. Food to me, everybody says food is your mood, and the acronym for why most people psychologically eat is FLAB: frustration, loneliness, anger, or boredom. But I feel, when you're eating live food, you feel alive. When you're eating dead food, you feel dead. So I'm one of those people that I can't just have one, so I'll have none. I'm not going to have the potato chips. I'm not going to have this or that. So very simple. Just taking baby steps. Be kind to yourself. If you fall off the wagon, so to speak, you can go right back in there.
It's very easy to slip and check.
If
you know how to, but you have to know how to.
It is.
So one of the things we've tried to teach you is that besides rendering you the upper cervical chiropractic care and all the nutritional support, we're trying to give you a first-class education on what health is, how it's affecting you, what things are affecting you negatively and positively, so you can take control of your health. You feel like we've done that adequately?
I do.
Good.
You've
enjoyed
like
the lifestyle classes?
I love everything about it.
Great.
I'm not speaking from any other place but my heart. For anyone listening to this, if you are in my position or if you have any kind of a health condition and you're really not sure, come on down to the office. There is a consultation here. You can meet with the doctors, and you can believe the hype. It's only been a month and change for me, and I can't tell you, I feel like a different person. I look different. I look in the mirror. I look at my feet, my hands. I'm blown away. I'm so grateful, and I really think you should come on down and check us out here.
Thank you so much, Pam.